High times for medical marijuana in Illinois.
There's no question that the horse is out of the barn, that public sentiment is behind liberalizing access to cannabis.
Zachary Zeisis is the owner of Dispensary 33, the largest medical cannabis dispensary in Illinois, located near Andersonville.
We've been open for 2.5 years, and I still run into people every day who are like, what? Medical cannabis is in Illinois?
By the end of last year, more than 34,000 people had applied for the medical cannabis program. It covers patients diagnosed with at least one of 41 state-approved conditions like chronic pain, seizures, or traumatic brain injury.
The benefits of medical cannabis are really far-reaching. It is the safest medicine available, certainly compared to any pharmaceutical out there.
Once they get doctor approval, they get a card, and then they are registered with one dispensary like D33 to get their product.
So we sell dry flower, we sell vape oil, we sell patches, tincture, edibles. Anything that is medicinally useful, we sell.
This is where things really get rolling for medical cannabis in the state of Illinois. A grow farm in Joliet, Illinois, owned by Cresco Labs, where this bud turns into the product patients can use.
Cresco Labs has become one of the top 5 largest cannabis companies in America.
Cresco Labs co-founder and CEO Charlie Bechtel gave our cameras a look at how their cannabinoid products are grown and cultivated.
In 4.5 months, this product will be on the shelf.
Herbologist Jason Nelson says it's a global task. 40 different strains from around the world serve different medical needs.
The sativas have a growth pattern that's very tall, stretchy, good for daytime use. It can be uplifting and stimulating, certainly a good appetite stimulant with a sativa. An indica, on the other hand, a different growth structure, shorter plant. It's going to be much more sedative and relaxing, so end-of-day use is more common there.
Among their biggest efforts is messaging, fighting negative perceptions associated with the drug.
Cannabis has a stigma. It has stereotypes that are associated with it. So overcoming those and showing people that cannabis can be done in a professional and I guess more traditional, normalized way is one of our primary objectives.
Bechtel says for Illinois, the future of ganja is green. While his company is focused on pharmaceutical cannabis, controlled recreational use could be a reality, but it's up to lawmakers to pass it.
The real-life, tangible benefits that we've seen from tens of thousands of patients make me feel that greater access to cannabis is a priority.
Incredibly interesting stuff, Brandon, and I gotta say, I happen to support the movement, but it's still jarring and still very much apropos to see a journalist holding all that stuff because you still have that criminal thought in your mind, and it's clearly not that. What was it like being behind the scenes?
Well, it was interesting to talk to them about the care and quality they put into what they do. And we talked about it in the piece. They're putting a lot into messaging and fighting that stigma you talk about in a sense. But they are really professionals about this, and they realize that they're doing a medical service, a pharmaceutical service, and they put so much care and security into it too. They have cameras all around the place. They have weekly inspections from state police and the health department and health inspectors. So they're really on their P's and Q's, making sure that everything's checked out and it's not getting in the hands of kids either.
Now, those who approach this conservatively may feel like, you know, marijuana is this gateway drug to opiate use and other harmful drugs. Was that something that they spoke about that they feel like they're trying to combat? And do you believe that that is a true belief?
Well, there's actually lots of research out there saying that medical cannabis could actually fight off the opioid crisis because people can use this instead of pills. And so it's a safer alternative, a healthier alternative, and it's not as addictive. Lots of research showing that. And really, you just talk to the people that are using it, you know, people that have seizures or epilepsy, kids even that have a lot of seizures. It's dramatically reducing those symptoms for people. So this is some life-changing stuff. Just going to be interesting to see what lawmakers end up doing with it.
No question. Quickly, Charlie seemed very confident that this bill would eventually pass. Did you have that same confidence by the time you left?
I think a lot of it depends on who's going to be in office in terms of the governorship. But I do think as attitudes change, we're getting more progressive with things, and I think that eventually it will.
Brandon Pope, great stuff.